house early in the morning with the cacophony. It's exciting to know there's so many people and up and about and eager to be helping our veterans. I really, that enthusiasm is infectious, and I thank you all. I do have some formal remarks, but I wanted to just say in the last, I started in the 70s at the VA and subsequently as a clinician, and subsequently had an opportunity years and years later to raise my right hand and become a soldier and support a son who did likewise. And now I'm supporting a Korean era disabled veteran and a World War II widow's veteran's widow. And it's very real to me what we do, and it's very real what we do in our communities. That's the roots that I come from. So I understand that what we do within our four walls, whether it's in headquarters in DC or in a medical center or in a regional office, is not what frankly matters moment to moment, day to day, the most. It really is what our community partners are doing. And I thank you for that, whether it's the incredible work that I've seen with the homeless down in Skid Row in LA recently, or the stand downs that were in North Carolina focusing on women vets, all over the country. You're just really leading the way, and we want to pledge that we want to hear you as well as our veterans, and we want to follow your suggestions and recommendations in enabling you to help us serve our veterans and their families, caregivers, and survivors to the best possible, highest quality care and benefits. That being said, I also want to say that I know there's a lot of changes that you are aware of in the VA headquarters. I don't think there's time built in for Q&As on that, but I'm happy to, at any time, through your contacts and my VEO team, to answer questions about that, changes and impacts, because you obviously want to know are our relationships that we have stable. I want to pledge to you that the incoming leadership at VA is as committed as the former leadership was. I won't make comparisons and say more so. I would just say that there is a steady state of attention to the mission and some refocusing on ways to make the system more rational and easier to access, not only for our veterans, but for you all. So if you have questions, certainly Jim is there. He can relay anything to me, but there is an ongoing commitment not to disrupt services as benefits, but as you will see throughout the day, to in fact continue the ways in which we're enhancing those. But we're excited. This is, in fact, the third of 5 CVEB network events, and the Veterans Experience Office is really honored to be hosting these, and I appreciate Jim and his team. Special shout out to those in the room and Andy. With our local communities, these CVEBs connect to our not only our VA leaders in health and benefits, memorial affairs, and the board, but with our state and county officials, academic members, our MSOs and VSOs, nonprofits, and our private organizations. I always love to walk into a CVEB meeting and see, you know, who's there from corporate and what it is that they want to be providing and assisting with. And it's not because they want something back, it's because they really want to give in their community. And many of them are veterans too, and it's wonderful. As you all may know now, we have 142 CVEBs. That's a testament to the growing commitment that communities have, and the way they see that these are really valuable ways to come together. Some of these, as you know, are long-standing, and others are newly formed. They're all at grassroots, and they're not something we dictate. They're something each community decides to organize, and we help facilitate their capacity. Over 30 of our CVEBs have now received our VA appreciation as veteran-friendly communities through this new initiative we have, and I look forward to seeing as many of you, awarding as many of those as I can, and to having another 30 of those as soon as possible. The goal of this event today is, and really our CVEB initiative, is to promote the local communities, as you all are the ones that build the coalition, and help us bridge the gaps in services. Another key role that you do is help us brainstorm and understand what the local challenges are and what the solutions are, and not one size fits all. As we share information together and we learn the lessons and hear what's working, we can better improve the local services and create a network that can support these veteran-friendly communities that you all are trying to create or have created. As I mentioned before, supporting the veterans and their families, caregivers, and survivors. Now, you will hear me use that phrase a lot. I do not believe that the veteran, just like military members, really are retained and stabilized because of family members, and that does not just mean a spouse and nuclear family. But when you're in the military service, you're supported also by family in addition to your family in uniform. And as veterans, we need to acknowledge that it's the family, it's the caregivers, it's the survivors who are critical supports, and they are our partners too. So we have made a pledge during the last year and a half to make sure we call out those other partners. And we're here to make sure that your work in the community is supporting of all of those. Some of the key partnerships are present with us today, and they certainly do recognize the veteran and the family and caregivers and survivors. America's Warrior Partnership is one, and the Bob Woodruff Foundation is another. Those are just two of the many that we rely on as strategic partners to achieve our collective impact. Our goal in that collective impact is more consistent, more complete, highest quality care and benefit services to improve the lives of the veterans and their families, caregivers, and survivors as they determine their needs are. It is not up to me to tell a veteran and their family what is best for them. They need to be telling me what they need at any particular time, and telling you all too, which you hear every day much easier than we do. At VEO, the Veterans Experience Office, we're really excited that we have had leadership to support to create a system using the best data, tools, and technology that industry could offer, best practices in customer services. What we can't do, what we can't buy, is the engagement piece. That's who you are. And without that engagement, we can't meet our critical mission. So it's our CVEBs and community partners that allow us to make sure we've got the boots on the ground, or as the incoming secretary says, that we are walking the post as we listen to the voice of the veteran. And that is our goal now through our customer experience, veteran experience initiative, is to make sure we're listening to the voice of the veteran and using all the data tools, technology, and your engagement to do that in real time. And why are we doing that? We're doing that so that we can actually make changes and make improvements. We're doing that so we can improve the care as an individual veteran received through what we call service recovery. We're also doing that so that by listening, we can see where there's trends, and we can see where program improvement needs to occur. If it's in one particular department at one hospital, okay. But if it's system-wide, we need to address that too. So we're using these things to address service recovery and program improvement. And I'm really excited. I hope that you'll have an opportunity when you utilize, those of you who are veterans and use our VA healthcare systems, please, as an outpatient, take advantage of our surveys. See how you can give us feedback immediately after your visit. We get that, and I can understand what that experience was on a real-time basis, and we can give that information to the providers in that facility and help make your next visit even better. We're doing so many things in the office. We're supporting, I know we've got Shaka there, we're supporting our Center for Women Veterans, our tribal outreach, we're supporting the faith-based, we're supporting the minority centers, and we're doing things like the Choose Home, which helps veterans and their families and caregivers stay in their home and their community. So I am just very, very fortunate to be able to have this opportunity to be with you, to be in the community, and to lead an excellent team. We're open to your suggestions and thoughts, and please continue to engage with us and to lead us into what your communities need.
Thank you, Dr. Davis. We appreciate those comments. We definitely appreciate your leadership through the transformation and kind of restructuring of VEO over the past 12 to 18 months. We are definitely set for the future with the close collaboration and partnership of all of our great community partners, both in the Veterans Engagement Boards and also these great nonprofits and other volunteer organizations throughout these communities. So I'd like to pass it on now to Mr. Jim Wartsky, who is our Executive Director for Community Engagement. He is the guy that is in charge of all of us out there in the field, attempting to create closer personal connections and develop trust so that we can continually work together to support veterans and families in the community. So, Mr. Wartsky.
Thank you, Cajun. Good morning, all, and thank you very much for those nice words that you were giving us of encouragement, Dr. Davis. Much appreciate you as our leader, and you're doing a great job to support us and the communities and the families. And it's all, starting from your guidance, going out to the field, and it's our pleasure for the community engagement team to be able to share our work with the communities and work with them to help our veterans.
Thank you, Jim, but I would be remiss. I cannot get off the call without giving a shout out to my buddy Cajun, who I did not hear the voice. I just have to say hello, and to everybody else in the room, but special hello to Cajun, and thank you, Jim. Go ahead.
Oh, you're welcome, ma'am. You should see the smile on Cajun's face from ear to ear right now. Thank you for that recognition, but it's the entire team that we have within VEO that does great work, and it's our pleasure to support the communities, and better way to say is to partner with our communities, as I have Justin and Stella, thank you, who are our co-chairs here in Fort Lauderdale. So thank you very much for joining us at the table. And that's the way I like to look at our organization, is that we are invited by the communities to join you at the table. We also have our Medical Center Director, Paul, here, who comes along. And this is what the spirit of CVEB is, the spirit of the community is, and the spirit of the VA is to join everyone to come. So are my slides being presented, Cajun? So I'm going to get started, and let's try to get the overview. I have the privilege of actually talking a little bit about the Veterans Experience Office. And I will focus on my specialty and the one that's most familiar to us all, and that's community engagement. But VEO is so much more than working with the community engagement. And I'll go into a couple of words on that as well. My challenge, though, is when I have spoken about VEO as an organization, I could easily take up an hour, and I've done it. And so, forewarning, I'm going to try to curtail our conversation down to something reasonable in the timeline that we have, and yet give an overview of what VEO does and all. Now, our organization actually started in 2015, and it was launched at the direction of Secretary McDonald and Deputy Secretary Sloan Gibson, and we've developed since that time. As you heard, Cajun mentioned that we went ahead and morphed into a different organization than what we started. And because of the leadership that we have and the way we look at relating ourselves and learning as we go along, we believe we're on the path that we're going to be improving ourselves to work better with communities. And if that's a requirement that we have to change again in the future, we certainly will. But we've actually gone through and worked now with the organization where at one time we had multiple districts working. We've changed to a better responsibility, and I tell you, I am privileged to have the responsibility of community engagement across the nation. And if you look at the first slide that I have, where it says that the Veterans Experience Office is collecting, analyzing, and sharing the experience of veterans, families, caregivers, survivors with VA services, and the big emphasis on that. About a decade or so ago, I remember everyone saying that we're focusing on the veteran. Well, it's so much more than just the veteran. It's the families, it's the caregivers, it's the whole package, it's the survivors who are there. So the VA has now looked at the entire organization of who is involved when we're talking about our beloved veterans and the times that they've served, because when a veteran serves, it's also the family that serves as well. And we also have the requirement of informing VA policy and operations for accountability, service recovery, and program improvements. And I look at that as being one of our core values in doing the jobs that we're doing. Next slide, please. And what this is going to show is our organizational structure. And as we just heard from Dr. Linda Davis, our Chief Veterans Experience Officer, and we highlight exactly where we are in the overall VA structure of the organization. And as you can see, Dr. Davis, who is a presidential appointee to our organization, is the leader of our group and has direct line into the Secretary's office. The communication, and you're going to hear me mention communication a lot, and I'm going to throw a couple stats out that are going to be rather impressive. And obviously I can tell you I'm impressed with them, being that we're an organization that just started in 2015, all the accomplishments and all that we've done. But I do promise that I will hold us way to the timeline that I have and not the hour that I normally take. But from the slide you can see that we report directly to the Secretary through Dr. Davis. Below is our deputy. In pictures is Barbara Morton, who is also in Washington, and Lee Becker, who is our Chief of Staff. And they both are supporting us through Washington and serving us in the field, serving you all in the field in any way we can, but it all enhances our communication capability right up to the top of VA. So if any issues are coming along, we are able to find out and relay it back. And I'm going to hear the discussion I'm going to get about communication, because it's a two-way communication. And I'll cover that in a little bit later. Next slide, please. So some of the accomplishments that we've done, and I'm just going to go outside the realm of community engagement, but some of the other organizational parts that we have that honestly I am limited in time, but I could go on forever basically talking what we've done in the short time. You have in our medical centers, and Paul could verify this for us, the red coats. I'm hearing that's an excellent opportunity going forward where you're greeted by an individual, sometimes a volunteer, who's wearing a red coat. Just say, hey, welcome. And also, as you're leaving the medical center, that there's a person there to say, how can I help you? Did everything go okay? What could we have done better? And we focus a lot on the customer service. We also are teaching out a class called Own the Moment, where we're going to medical centers and training the staff to teach the teachers in that staff to have a different cultural effect to Own the Moment. And that's Jennifer Purdy's organization, the one that we're facing with our PX group. We also have, for a perfect example, we have the welcome kits that we're putting together through Mike Jalushis, who's doing much of the VBA work with us and working with NCA at the cemeteries. So you're getting the flavor that we're a conglomeration of many of the organizations and agencies represented in the VA trying to put it together to serve the veterans the best we can. And Mike is working on having our welcome kits. So when veterans are coming out into the community, there's an online welcome kit, or we're going to have hard copies being able to give to veterans as they're leaving. We also have one of our better successes under the new administration that we have is the White House Hotline, which Denise Kitts is what we're looking over for us. And Denise is doing a great job as an executive director with the White House Hotline. So we have a better communication through telecommunicating from issues coming up from veterans in the field. We have Joy White, who's observing our portfolio management. She's an executive director of supporting how much VA can take in or how much VEO can take in with the resources that we have. And there's so much work for us to do, but we have to make sure we can staff it properly. And of course, lastly, I'm going to talk about Curtis Carey. And Curtis Carey is handling much of our matrix work. As you gather up much data, we're going to analyze the data and see where we can support. For example, and Paul, I'm using this as an example, but if some data comes forward and there's a way that we could relate to you saying in the community it's coming and we're being shared with the information that this is coming as a result that we're looking at, we'll get with Jennifer, we'll get with you, say, hey, this is a concern that's showing up or a trend that's showing up. Right. Let's address it in advance. But it all comes down to a partnership. It all comes down to a partnership with the group that I have, and that's the community engagement. And that's where we want to listen and pass forward information. But my key point is on listening. So here's the community engagement slide. You could read much of it, but I'm going to just highlight a few. Remember I referenced veterans, family, caregivers, and survivors may not have access to coordinated support of local veteran services providers or advocates and community leaders. VA must partner with local communities. And we are convinced through our short 3 years and even the past that we know, that's the way of the success of our organization. That's the way of our success to treating veterans, families, caregivers. When we partner together, when we listen to each other, especially when VA listens to the community, and my people listen very well, we really can gain a lot and support the veterans who are out there trying to get better settled in. The approach? Well, the approach is very simple. Coordinate with key partners in the state and county levels, the government officials. It's not just the federal government doing it. We need to partner with state communities. And each state is different, and the counties, they're all different. But when we all come together and work together, we become that force multiplier. And I'm going to show that a little bit more in a follow-on slide. But also, when you're working with the VSOs and the 501c3s and some of the great organizations that all want to do good, but when we all come together and work together, we become that force multiplier. Like in my old terms, that combat multiplier, because we're all focused on supporting each other, and it builds upon each other. And that is the beauty. And where does it all come together for a lot of us? In the community. And as we have two of our volunteers right here, Stella and Justin. You all volunteer. I appreciate it across the country as we do that. And it's your area where all this information comes together, and we share it, and we can act on it. I mentioned I was going to say a couple of stats. We heard 142 CVEBs. Well, I'm very, very proud to know, or to at least announce right now, that the actual number as of this Monday is 146. 146 different community veteran engagement boards throughout the United States. That is fantastic, as this is continuing to grow, because everyone is seeing the successes that we're gaining in this partnership with the communities. And our last one, as of this Monday, the Veterans Coalition of San Luis Valley in Alamosa, Colorado. So welcome to the team, Alamosa, Colorado, and we much appreciate the work that we'll be doing. And there's an issue going on too. Some of them are at different levels. We understand that some of these CVEBs have been around for a few years, probably honestly before 2015 when we launched the CVEB program. Some communities are doing it, but since we've launched it in 2015, we're up to 146 right now. And the ones who are coming in later, well, this is the other part of our community engagement responsibility. The networking events like we're experiencing today. So we can share best practices. So one who's a apprentice at learning this can learn from the ones who have been doing this for years and share that communication, share those lessons learned, share those after-action reports. And that's the beauty of our networking events, is that we're trying to bring the communities together. So it's not the VA doing it, but that's the communities talking to each other, saying, I've had this problem, or this county, or this state is going this way. What's a better way? With one grand focus, that we always focus on the veteran, survivor, caregiver, the families that are there. And it seems to be working very, very well. Establish strategic partnerships. We need to have a strategic partnership in the sense that we all work together. Remember I used that word? The combat multiplier, the force multiplier. Strategically, we work together, and we can do that. And if there's resources that can have out, we can bring them in. And there are many, many 501c3s, there's many corporate America organizations that are seeking avenues to support their veterans, well, through the CVEBs, in the communities that they're in, Atlanta, Georgia, or Pittsburgh, or cities like that, where some companies are coming in to support them. This is an avenue for them to come in and support, and I'm very pleased to know that we've been successful in getting that. And of course, the last thing that we are doing with community engagement is we're supporting some of the federal advisory committees, where the committees get together to give an advice on how to work with the secretary to get some resolutions done. And right now we have one that's being led by former Senator Elizabeth Dole, and the other one is being led by General Hopper. These are great opportunities that we have to work in the Federal Advisory Committee. And what do we anticipate as our outcomes? Well, I mentioned it already too, in a very, very good manner. I'm looking at two-way communication. We want to listen, and we also want to be passing out. As I mentioned earlier, and I'll mention it again, my team listens very well, and we support listening to them as best we can. I want to give some other stats that I said. As I mentioned that there are 146 CVEBs in the network right now. Those 146 CVEBs are reaching 12.5 million veterans, over 50 million families, caregivers, survivors, who reside in the catchment area. 50 million families and caregivers and veterans are being affected by the work that 146 CVEBs are doing in the community. It's our way of reaching out with the primary mission, as I'm going to say for the third time, listening. The VA needs to listen, and we want to hear what the communities have to say. Next slide, please. Cajun, how am I doing on time?
Got about 5 minutes, Jim.
Okay, we're going to, so I said I could easily go for an hour on this, and so we're going to keep ourselves to a normal abbreviated state. If you look at the slide that's being presented, to the left of that slide, you see the typical veteran and family coming into a community. And where do they go? And I love the pictorial on this one because there's all different directions. They don't know if they should go to the state. Should they go to the county? Should they go to the federal government? Where should they go? Should they go straight to a 501c3? But in the CVEB model, as you look to the slide portion on the right, well, the CVEB becomes the hub, or as I commonly call the nucleus, where the leadership is there bringing everyone together. It's chemistry talk, I guess, or sometimes I'm trying to bring it all in. But that's where it all happens, is that CVEBs. And that's where our communications happen. And everyone starts leaning in to become that force multiplier. And the veteran could go to the CVEB and say, hey, this is what I'm trying to do. And it's not all just 501c3. It could be something simple like a mentorship program. It could be something like, looking out for each other, a community, a brotherhood, sisterhood that we have. Because we now have something all in common. And that you served our country in our combat arms. And for that, we want to assist in whatever way we can in making a clear path for our brothers and sisters who are coming out of the service by those who are in the service, mentorship programs, helping jobs, helping getting houses, whatever the community can do to support, plus the 501c3 and the requirements that are needed at the VA as they're processing through. Next slide, please. A very quick pictorial of the United States, and this is what we look like with about 140 plus CVEBs across the nation. And there's still room for growth. We know it, but that's what we're looking at right now. That is our footprint as you put it down. And I'm very glad to see that we have the Virgin Islands on that one because we haven't omitted them at all. We work very closely with all our territories and all the states, and we understand that we're going to continue growing as the need survives. And the last slide I'm going to put up is what I'm going to be focusing on one more time, is that if there is any assistance that is needed, and trying to support it, you have myself, my email, direct email to me, and you have my deputy, Chris Olson, who can take these emails in. And with my team, we are willing to help out in whatever way we can, and we have a team such as Cajun is here, and I saw Doug Webb on the site, Tony Davis is at another site, we have Andy Martinez at another site, who are all supporting the CVEBs that we best can. And if you know that there's a requirement in your neighborhood, or you want to get one to start up, or you know of an organization that needs one because they're gaining that momentum of supporting our veterans, please contact us. And on behalf of myself, or the community engagement team, people like CVEB, Cajun, and all the CVEBs that we're supporting, we have, as I mentioned, Chris Olson, my deputy. I have Lynn Patrick, who's my administrative officer, assisting us, and Andy Martinez, who's my program manager. We are all here to support you in the field, and we are so supportive, and we are so pleased that we are partnering together to serve our veterans, caregivers, survivors, and families. So thank you very much for the time that I had a chance to give a very brief overview, focusing mostly on the community engagement, my piece of the pie over here. But I appreciate all the time that we have as we continue on this morning with our networking event. Thank you.
Thank you, Jim. So next, we have a presentation on the Women's Human-Centered Design project from one of my esteemed colleagues, Shaka Khan Lee. I miss you, sis. You're doing a great thing in the Women Veterans Program, and so I'd like to turn it over to Shaka to provide us with an overview of what is happening within VA to focus on our women veterans, and also maybe some of the plans for the future as we go forward in collecting data and information to better serve that segment of the veteran population. Shaka, all you.
Thank you, Cajun. A quick question. Do you have the PowerPoint, or do I need to present it myself?
Shaka, this is Tony. I can run the slides, the latest copy I have for you, or you can run them. Your call.
You can run it, Tony, please. We're going to start at slide 10. Okay? Well, good morning. Thank you, Cajun, for that great introduction. Like you said, this is my team, will always be my team. Thank you, Jim, for that great introduction of VEO. I could have sit and listened for you for a whole hour because I am a big fan. I'm not biased to anything of VEO. But as I said, I actually used to work directly with Jim Worski and Cajun and Tony, and I miss them dearly. They will always be my first family at VEO. And thank you for inviting me to speak on the Women Veterans initiative that we have and our partnership with the Center of Women Veterans. Kayla Williams was scheduled to present today. However, last week, Kayla resigned from the VA, and so she actually went to another facility, another office, and so we wish her well. We're going to miss her greatly at the Center of Women Veterans. But so I'm going to present an abbreviated presentation today, and on our next CVEB presentation, her deputy will join us, which is Anna Crenshaw. So first I want to thank you again for having me. And as a woman veteran, I appreciate and I'm very hopeful that VA is doing a deep dive into women veterans' pain points and challenges to get an understanding of what we as women are experiencing as we engage with VA, particularly VA healthcare services. Again, like I said, as a woman veteran myself, I am, again, very hopeful that we're going to make some changes and help rebuild that trust with our women veterans. Women veterans are the fastest growing demographic group of veterans in the United States, and they currently make about 2 million or about 9.5% of the 20 million living veterans today. Whereas the number of veterans are overall decreasing, the number of women veterans are increasing rapidly. This continued rise will result in a more demand for women health care services, and so we want to definitely capitalize on those engagements with our women veterans. Our annual surveys indicate that women veterans have lower trust scores. So we in VEO office, or Veterans Experience Office, administer an annual trust survey. And when we received those results back, we saw that our women trust scores are a lot lower than our men. And so to understand why, the Center of Women Veterans and VHA, or Veterans Health Administration, Women Health Services, and the Office of Veterans Experience teamed up to explore currently why women veterans trust scores were so low. Our research, we spoke with women who currently use VA health care, who tried to access VA health care, and women who at one point in the past used VA health care but never returned. So by helping to document where women veterans experience pain points and challenges along their outpatient care journey and within VA, we can work to address those pain points and improve the experiences and, again, bring those women veterans back into the VA to use their benefits and services. We want to create a consistent experience that will build that trust across and within VA facilities, where women can feel like they can trust us as VA. And, again, we want to improve that care for women veterans. And when we improve the care for women veterans, we will elevate the care of all veterans. Next slide. For the women we spoke to, we facilitated one-on-one interviews. We facilitated human-centered design workshops, and I'm going to go into detail a little bit later about what a human-centered design is. We also utilized qualitative and quantitative data from our Center of Women Veterans, as well as Veteran Health Administration's Women Health Services, their barriers to care reports. And so we use all that data to facilitate, to actually deliver some of our statistics. So the women that we spoke to had an average age of a little bit around 51. 15% saw their providers in the primary care clinic, and the other 85% saw their providers in a women's health clinic. 38% served in combat, and the average year served was a little bit over 10. And we spoke with women in every occupational field, or MOS, as some of us military-minded individuals address our occupational specialties. We spoke to women who were CIA agents, drill sergeants, military police, chemical operations, clerical. They were in all occupational backgrounds. They served all over the country, in several combat zones, as well as in different countries. And we talked to enlisted as well as officers. And we had a very diverse background. Next slide. So when we spoke to women, or what we gathered from these workshops, was that women wanted to feel like they was in good hands from the start. They didn't know what to expect once they entered the VA healthcare environment. They were very vulnerable because many of our women had experienced military sexual trauma, or had experienced some type of sexual harassment and catcalls when they did come to the VA. And so they wanted VA employees to show empathy and show sympathy, and to help guide their journey based on that sympathy and empathy. And so the thoughts were very unknown. The challenges were unknown of what to expect. They also told us, or what we heard was, they felt like, when they came to the VA, they had to keep retelling their story. Then when they did show up for their appointment, when they got to their appointment, finally saw their providers, the provider was different, and no one told them before they arrived at their appointment that their provider would be a different provider. So again, having to retell that story, which took up most of their time with their providers, and they felt like they also didn't know how much time that they were giving as they arrived at their appointment. Was it 90 minutes? Was it 15 minutes? Was it 60 minutes? And they wanted to, again, feel like if I had those, those key information before I arrived, then my appointment or my engagement with VA would be better. Next slide. So in all the research that we gathered, there were 5 key things that rose from the data, or what we call the moments that matter most. And those 5 things that emerged were, that women wanted the need to have compassion, to be shown respect, and they wanted customer service to be rapid and responsive. They wanted the need to have a connection with their provider, healthcare team, and other women veterans. They felt like there were inequality in care, or inequities in care, but in specific specialty care, there was not easily addressed in the current VA structure. There was eagerness for women veterans to co-design solutions for their care. They felt like, they didn't want to just complain. They wanted to be a part of the solution. They wanted their providers to involve them in their care plans. And just to go into detail, when I say that women wanted was perceiving inequities in their care, when they felt like they went to one facility, Like, say, for instance, we heard one woman say that she would go to the facility in North Carolina and would receive certain specialties or certain care, and then she would go to Texas and ask for that same care or same treatment and was told that that VA did not provide it, although she did already receive it in North Carolina. We also heard that they perceive inequity in care based on their employee status, meaning that as an employee, I can walk into a facility or call a facility and get an appointment, but yet as a veteran, I was not easily able to access my services because I was calling from my personal phone. And to go into a little more detail also about the specific healthcare needs that are not easily addressed in the current VA structure, women veterans felt like their gynecological needs, they was often being sent to private healthcare facilities for those needs, in which they wanted to be in-house. They wanted to come to the VA because when they go out to these, to the private sector or to the community care services, they felt like they weren't being treated as veterans, and that the healthcare teams wasn't was providing as much sympathy and empathy as the care that they could possibly receive in the VA. Also, they felt like, once the billing for that specialty care, the bills were not being paid by VA, which caused an adverse effect on their credit report. Next slide. So all the data that we gathered, we asked women veterans in those workshops to identify the moment that mattered most to them, and we used the veterans experience patient experience journey map, which is a journey map that we currently have that was developed maybe over a year ago, which actually gives the moments that matter from before the appointment into after the visit for the average veterans experience as a whole. So we use that as our basic or as our platform to develop our VA women veterans patient experience map. And so we put a blank journey map on the board, and we asked our women veterans to use stickies, just average stickies, and go up to that actual journey map and to place a sticky on the moment that mattered most to them, and to write why, to give us an explanation of why that moment mattered most. And as you can see from the journey map, if you can see it, and I'm going to ask Tony that he send out a copy of the journey map and the storybook to the attendees so you guys can have a full copy of this. But as you see, the most of the pain points are demonstrated right in doing the appointment and specifically a meeting with their provider. And we've heard, that was the moment that mattered most to them, and that was where they experienced most of the pain points. Next slide. And so the approach that we use in order to gather the research, in order to gather information from our women, is called a human-centered design. And we at VEO, and which makes us different from all agencies and programs in the VA, is that we actually talk to our customer, in this case our women veterans, and to understand their needs and wants. And then we develop resources or products or tools that they wanted, that actually we co-authored with our customer, and that we heard what their wants and needs are. So it's a qualitative research, and we center our research efforts around the people and their experiences, processes and systems to gather their insight, and then use that insight as touch points. And so that's the nature of most of the work that we do in VEO, in gathering customer experiences, and that way we're better to create change or design solutions, again, based on the customer needs. Next slide. So we want to read you some of the quotes of what we heard from our women. One of the quotes we heard was, "I want the provider to treat me like a whole person and not just someone assigned to you. I love my provider. She listens. She's attentive. She's not afraid to admit when she doesn't know and needs to consult. And I can say, I found this, and she'll say, oh, that's interesting. Let me see. And I like that she's open and she thinks about things in my care that I don't even realize that I need. Another quote from a woman veteran was, we women veterans are our best advocates, and let's look for openings and let's look for ways to advocate. Let's make sure veterans are part of the solution. And those are a few quotes that we heard from our women veterans. And some of the feedback that we received, we also created a video. So we had we requested or had a request from some actual professional actresses to protect the integrity of the research, and we promised the women veterans that their identity would not be exposed. So we did get women professional actresses to do voiceover work to voice over the quotes that we got directly from our research. I'm not able to show it to you today, but again, I would ask Tony that he would send the audio out as part of the package so you guys, for women, will be able to hear exactly what some of the women veterans said in those workshops. Next slide. And so what are we going to do? That was some of the questions that women veterans asked us as VA employees. And, hey, we do workshops. We talk about all these pain points and challenges. But, what are you as VA going to do? And so we created a storybook, and I have it here. Again, I'm going to ask Tony to provide an online copy for you. We designed a storybook that gave the complete story from beginning to end of the processes. And in that storybook, you will read that there were several recommendations provided from the Veterans Experience Office to the field staff and to VA leadership, again, at the facility level, division level, as well as VA leadership level, of ways that we can improve our experiences and improve our engagement to help rebuild that trust with women veterans. And so one thing that we also did was we created design opportunities for further research of what women veterans wanted to see. And some of those design opportunities was built around how to create a culture where women veterans felt equally respected as patients, and also how to foster a more positive relationship between women veterans and their providers, as well as, how do we set expectations? Because that was a key factor in providing or improving the experience, rebuilding the trust, is what are we going to expect when we get to VA? You can just tell us, tell us what to expect when we get there. We'll be more open and more trustworthy of of the VA. And so again, I'm going to ask Tony that he provide that storybook to you. That way you can have a copy of it so you can help address some of the needs and challenges in your community with women veterans. And just want to do a shout out to the Medical Center Director in North Carolina. He actually, once he was provided a copy of the storybook and the journey map and the video, he had a stand down as well as a women veteran town hall, and because he wanted to hear from himself of what the concerns were of the women veterans that were under his catchment area. And so some of the feedback that he provided to me was it was very eye-opening for him to hear directly from the women veterans. It was the first time that facility had a women veterans town hall. The women were very candid, and so he said that he would definitely have a monthly town hall with women veterans and action plans for all of the issues and concerns that was addressed or that was said in those town halls. So kudos to him for being open to our recommendations from the Veterans Experience Office. But I also tell our veteran service organizations and CVEB that hold us accountable as VA. You are the ears and eyes and the voice of women veterans in your community. So make sure that those voices are translated through you and to us so we can work together and partner to address some of those pain points and challenges to improve the women veterans experience. Next slide. And again, how we foster trust with our women veterans. How are you fostering trust in your community with your women veterans? What are we doing? What are you doing? What are we doing together to partner? I often ask myself this as I'm, out in the field or talking or any type of field work of what, what am I doing? Not just what am I saying, what am I doing to foster that trust? And so, Tony, that's all I have today. I can turn it back over to you, but if there's any questions, I'm open to any questions that anyone may have as far as the presentation or anything that we're doing to partner with our Center of Women Veterans and VHA Healthcare Services to improve our trust with women veterans.
Thanks, Shaka. So this is Cajun back in Fort Lauderdale.
I'm sorry, Cajun. I'm sorry.
No, you're fine. You're fine. What we'd like to do is probably move on to the next presentation with Amy Reichert from the America's Warrior Partnership. Are you going to be staying with us, Shaka? Do we need to present some questions now? We do have about an extra 5 minutes, but I would prefer to progress and then talk about that during the Veterans Engagement Board interactive conversation piece.
I actually have another meeting to go to, Cajun, in about 30 minutes. So I'm on for another half an hour.
Okay. Tony, did you have a comment?
We do have a question here in Jacksonville.
Okay, sure. Go ahead.
Thank you so much, Shaka, for your presentation. My question is, after the presentation in North Carolina where they realized there was a disconnect between women veterans, has it been recommended to other medical centers to follow the same suit, to host a town hall with their women veterans and find out what the concerns are and create an action plan to address them?
Thank you. What was your name again? I'm sorry, I didn't hear your name.
Helena Pugh, Zahara Veterans Network, Jacksonville, Florida.
Thank you so much for your question. And great question. We actually are partnering with the Women Health Administration's Women Health Services, which is the leadership in Women Health Services for all facilities. And so we're using the North Carolina Town Hall as a model. There were also another town hall in Fayetteville that is scheduled. It hasn't happened yet, but they're scheduled it, I think, for September. So Vision 6 is definitely on board with these women veterans town halls. So we're in talks with VA leadership to make this a standard. We're definitely trying to partner and try in hopes that this will be the standard as far as getting feedback from our women veterans directly to the leadership locally.
Did that answer your question?
Did that answer your question?
Oh, yes, absolutely.
Thank you.
Sure. Do we have any questions from other sites quickly before we lose Shaka and move on to the next presentation with America Warrior Partnership? Outstanding. Shaka, thank you very much for your time. We appreciate that information. We appreciate all the work that